Ladies and gentlemen, good afternoon, good morning, depending where you're tuning in from. Thank you all for honoring our invitation and for joining us today virtually at this important meeting. I understand we have about 300 participants online following this event live. In the first part of the program today, ACPF will be presenting its new report entitled The Economic Case for Investing in Children in Africa, Investing in Our Common Future. ACPF is very proud to launch this pioneering report today, which looks into the importance of investing in children, but from an economic angle. The launch of the report will be followed by a high-level technical panel, which will be discussing issues around the theme of the report. And then in the second part of our program, the winner of the 2021 Guy Larissa Award, a special edition dedicated to ending child labor in Africa, will be announced. Ladies and gentlemen, we have simultaneous interpretation in French and English. You can easily access the service through the portal. Even if you experience any technical issues, please go to the support page on the right side of your portal and use the email address there to contact our technical team. They will assist you. We will, as much as possible, try to keep to the timeline of the program so that we can finish on time. And so, without further ado, I would like to now invite Dr. Joanne Nyanyuki, the Executive Director of ACPF, for her welcome address. Dr. Joanne Nyanyuki, you have the floor.
Thank you, Sarah, and good afternoon, good morning, dear participants, ladies and gentlemen. Welcome to this virtual conference where we will be looking into economic policies and child rights, and we will be making a case for increasing economic investment in children. Thank you for your time with us. Over the last year, the African Child Policy Forum has been working on a program that aims to contribute to the formulation and implementation of economic policies that are sensitive and responsive to the rights and well-being of children. In this program, we have prepared a report which we will launch this afternoon, The Economic Case for Investing in Children, Investing in Our Common Future. We have also developed a broader program titled Children and Economic Policies in Africa that we will run over the next 5 years. The report that we are launching today is therefore part of a wider program in which we will seek to promote better investment in children across Africa. It marks the beginning of a new journey in our Pan-African advocacy work and complements what we have already been doing on legal and policy and social policy advocacy. We will today also be announcing the winner of the Guy Larissa Award 2021 Special Edition. This edition is dedicated to the elimination of child labor in Africa, in line with the UN declaration of this year as the International Year for the Elimination of Child Labor. We have an engaging 2 hours ahead of us. In these 2 hours, you will hear from a wide range of distinguished speakers, well-renowned, experienced in their fields of work. They will link the realization of children's rights to economic policies, to financial investment. They represent different organizations, institutions, and networks from Africa and the rest of the world. And they will be sharing their reflections from a global or regional perspective on this very important theme of today's event. Ladies and gentlemen, economic policy making and strategizing has unfortunately often followed an approach that effectively keeps it out of children's reach. Children remain invisible and do not feature strongly in these frameworks. As a result, economic policies and strategies in many countries across Africa lack sensitivity to children's rights and well-being. Investing in children, particularly in their early life, is an effective way of creating a path to the full realization of their potential. It also creates a level field for learning during childhood and future earning opportunities in their adulthood. In effect, it is a viable strategy to address the root causes of the deepening poverty and widening inequality that we are experiencing in Africa, made worse by the COVID-19 pandemic. We are observing a circular relationship between child well-being and economic performance. Simply put, poor child well-being contributes to bad economic performance. Parallel to this, poor economic performance in turn contributes to poor child well-being. This is a circular but negative relationship that should concern all of us. This constitutes and continues to perpetuate the cycles of poverty, both at individual and societal level, and unfortunately and regrettably across the continent. Ladies and gentlemen, despite compelling evidence, such as what we will present to you in our new research report, the general tendency in many African countries is to see resources spent on children as an act of benevolence, rather than an investment that will yield huge returns in the longer term. In a short while, we will hear a very brief summary of the key findings of the report, but I would like to say a few things about it, a little bit of a teaser. The report provides extensive evidence on the economic benefits of investing in children within our African context. It is sensitive to the realities of our continent. It brings out very clearly the huge cost of inaction. And it goes on to make a strong case for investing in children and the implications such investment has on long-term economic growth and, moreover, on Africa achieving its aspirations in Agenda 2063 and the SDGs. Ladies and gentlemen, I don't want to sound alarmist, but our research is showing that Africa is on the verge of a serious human development crisis. Such a crisis would carry grave consequences for the social and economic well-being of its people and for the future of our continent. By demonstrating the unacceptable and unnecessarily high cost of inaction, the report strongly makes the case for a massive investment in the needs of children in Africa. I believe that the findings and recommendations of this report will be of interest to African governments, particularly policymakers and practitioners responsible for planning, budget, and finance. It will also be a useful tool and a useful resource for parliamentary standing committees responsible for social affairs, budget, and finance. The African Union, regional economic communities, and civil society organizations will also benefit from reviewing our findings. And I urge all of them and all of you to use the evidence to bring about major transformative actions that will help Africa to reap the demographic dividend from its young population. This will be key in accelerating our continent's sustainable and equitable development. Distinguished ladies and gentlemen, with these brief remarks, I am pleased to announce the publication of the report titled The Economic Case for Investing in Children, Investing in Our Common Future. It is now available on our website on a special web page we have created for the purpose of this conference. I invite you all to access it and make very good use of it. Thank you for your attention.
Thank you very much. Thank you very much, Dr. Nyanyuki. Our next speaker is Dr. Najat Mala Mjid, the Special Representative of the UN Secretary General on Violence Against Children. Unfortunately, due to conflicting schedules, Dr. Mjid was not able to join us this afternoon, but she has sent us a video message. Let's listen to it together. Thank you.
Excellencies, distinguished participants, dear colleagues, dear children and young people, I would like to thank ACPF for having me today in the launch of the economic case for investing in children in Africa, investing in our common future. It's a timely advocacy tool, echoing the ILO and World Bank reports on investing in social protection and human capital. My remarks will focus on 4 key takeaways reflection. First, investing in children in Africa cannot wait because children in Africa are facing many challenges. As you know, before the pandemic, children in our region were already facing many challenges that impacted their protection, development, and well-being. The pandemic has increased violence against children at home, in the community, and online, as well as gender-based violence. In addition, the socio-economic impact is increasing the risks of child labor, child sexual exploitation, child trafficking, child marriage, and enrollment of children in criminal and armed groups. The pandemic has significantly impacted children's mental health. School closure and remote learning resulted in significant learning loss for students, both academically and in their socio-emotional progress, and highlighted the digital divide. The pandemic has revealed and exacerbated social inequalities, affecting mainly the poorest and most vulnerable children. Second, investing in children in Africa cannot wait because despite huge efforts, challenges remain. The pandemic has severely tested the capacity of states, communities, and families to ensure children's education, protection, mental well-being, and social welfare. We know many actions were undertaken by states, but a lot remains to be done in terms of implementation and scaling up and sustain those actions to make them accessible to the most vulnerable ones. According to the recent ILO report, only 26.4% of children are covered by at least one social protection benefit globally, compared to only 12.6% of African children covered by at least one social protection benefit. Third, investing in children in Africa cannot wait because children and young people represent a strong human capital. We need to keep in mind that Africa's young people are the continent's richest resource with a rapidly and ongoing growing population that is expected to reach 830 million by 2050. As it stands, almost of Africa's population is currently under the age of 25, making the continent the youngest on the planet. With this human dividend and demographic growth in the region, children and young people represent a strong human capital to invest on. Children and young people are key partners and not only passive recipients of services. They are already very active in this region, so we need to involve them more and more as they are part of the solution. 4. Investing in children is key for a resilient and sustainable recovery from the pandemic and beyond. We must learn the lessons of the pandemic and the humanitarian crisis, and we must look beyond COVID-19 and be ready for other crises and disruption caused by conflict, natural disaster, and other disease outbreaks. We must move away from siloed and unsustainable approaches. Our vision and action must be broad, based on a child rights, life cycle, and cross-sectoral approach. To this end, we must strengthen and scale up across sectoral systems, including child-sensitive social welfare, protection and care services, safe and empowering education, including digital learning, equal access to health and mental health services, child and gender-sensitive justice, as well as parenting support and sustainable social protection for vulnerable families and communities. The study launched today highlighted that spending on this integrated system for children and their caregivers is a key investment despite the fiscal constraints created by the pandemic. This study shows clear evidence on the economic benefits of investing in children and highlights how government policies can drive to important positive changes in this regard. And this study shows that investing in children has a positive and economic return for all to it, as the opposite of the considerable loss and costs associated to the failure of investing in children. Dear participants, let me reiterate how this study is a timely evidence-based advocacy tool that could be used, one, to highlight that investing in children contributes to the achievement of the SDGs and African Union Agenda 2063. Two, to widely mobilize and involve all key stakeholders, including children and youth at global, regional, and country levels. Investing in children in Africa cannot wait, because children are not just the future, they are the present. I thank you all for your attention.
Many thanks, Dr. Najat, for this important message. I now invite Dr. Addis Ymer from ACPF to present key findings and messages from the new ACPF report on the economic case for investing in children in Africa. Dr. Addis, you have the floor.
Thank you very much, Sarah. Distinguished speakers, dear participants, ladies and gentlemen. Good morning, good afternoon, good evening, depending on which side of the world we are. In the next 40 minutes, I will be discussing the key message of the report very briefly. Next slide, please. My presentation will cover 4 major areas of the report. First, I will discuss why the report. Then I will be discussing the general analytical framework that we have used in investigating the benefits of investing in children and that of the cost of inaction. And then I'll pass to highlighting the findings of the report. And finally, I'll talk about some pointers with regard to actions for policy priorities. Next slide, please. Why the report? Needless to say, investing in children benefits both the children themselves and nation's socioeconomic development in general. Given this fact, however, an African initiative that comprehensively and rigorously analyzes the economic significance of investing in children, one that examines the cost of inaction, and one that actually also assesses policy implications from the perspective of child rights is critically missing. As a result of this, there is a limited awareness on the subject among our policymakers and practitioners in most countries of Africa. This report is an attempt to bridge this gap. Thus, the main objective of this report is to promote increased and improved investment in children in Africa by showing investment in children is indeed backed up by sound economic analysis. And also, the report is intended to serve as a powerful continental, regional, and national level advocacy tool on the agenda. Next slide, please. With regard to the analytical framework that we have used in developing this report, let me say a few pointers. For instance, if we talk about the benefits of investing in children and consider, for instance, stunting has an implication for morbidity. Stunting has an implication for mortality. Both morbidity and that of mortality do actually have a say in negatively affecting the human capital investment in a given national economic system, which in turn affects in the medium term to the long run that of the labor supply and hence therefore the productivity of our labor. On the other side of the spectrum, stuntings do actually entail high health expenditure outlays, which actually requires more resources from an already meager amount of resources that is available across different sectors. And hence, it will impact our physical capital investment negatively. These various factors, reinforced together, will ultimately impact our economic growth negatively. Next slide, please. If we see one more example from the analytical framework and consider the case of, again, investing in children's social protection services, investing in social security systems, particularly for children and for families, often results higher income securities. This will actually entails usually better access to food and better nutritional status for children, which again leads to better health and more favorable physical development. Children will have an increased access to quality education. They will be less engaged in child labor. At the end of the day, they will have better educational performance. All this together, reinforcing one another, will lead to, between the medium term to the long run, a more productive and better employable workforce. If this is the case, these are the fundamentals and the bedrocks for fundamental causes of economic growth. And hence, therefore, economic growth that is inclusive in its nature can be fostered by investing in our children's social protection programs. Thus, it is in the context of this broad analytical frameworks that the findings that I'm going to discuss in the next slide needs to be understood. Next slide, please. When we come to the highlights of the key findings of the reports, if we start from investing in children's health, it is found in the report that investing in children's health yields high private and societal economic returns. For instance, reductions in child and maternal mortality accounted for about 11% of the economic growth in low and middle income countries between 2005 and 2010. This is a country grouping where all of African countries practically belong. Another example, increase in vaccination coverage in the poorest countries of the world actually estimated to save close to 6.2 billion in treatment costs and reduce productivity losses by about 145 billion US dollars. Again, in the poorest countries of the world is where, again, the majority of African countries actually belong. Next slide, please. The report also found that failure to invest in our children's health entails huge cost of inaction. For instance, our estimates show that the nearly 3 million under 5 child deaths that have occurred in 2003 in the WHO Africa region, which actually covers 46 countries, could potentially lead to a decrease of future GDP by 115 billion USD in these countries. For instance, Nigeria takes the toll, Angola follows, South Africa then comes, then Ethiopia, the list goes on. If we see actually the top 5 or 6 countries, all are some of the biggest economies where the majority of their population is child population. Thus, not investing in children's health is an expensive exercise than that of its alternative. Next slide, please. When we come to nutrition, investing in child nutrition again brings high or huge private and societal economic returns. For example, estimates show that for 15 African countries, the benefits of investing in undernutrition program would amount to 83 billion US dollar. These gains are basically the highest for Nigeria, Ethiopia, Tanzania, and the list goes on. Again, if you focus or if you zoom on the countries that are the major beneficiaries of these investments, we found them again some of the the biggest economies in the continent, where again the child population is the lion's share. Estimates also show that interventions to reduce chronic child undernutrition in Africa brings a high and substantial benefit to cost ratios. Next slide, please. The economic cost of inaction is also unacceptably and unreasonably high. It is found in the report. For example, in Africa, adult productivity losses due to those suffered from stunting in their childhood reduces current GDP by an estimated 9 to 10%. Another example, if we take malnutrition, malnutrition costs African economies between 2 and 16% of their GDP annually. Again, the lion's share is basically taken by Ethiopia, Rwanda, Malawi, Burkina Faso, and Tanzania. Moreover, evidence also shows that children who are stunted are 33% less likely to escape poverty as an adult. Next slide, please. With regard to children's education, investing in children education brings high economic dividends, both for the individual and for the nation at large. For instance, our analysis for 33 African countries for which comparable data is available, we have found that the economic case for investing in basic education is stronger for Africa compared to other regions of the world. In the macro side, education is the base for human development, which is again the bedrock for growth. With regard to the macro side impact of basic education, even though data are very scarce in Africa, evidence from other countries shows that a 1% change or a 15% increase in enrollment rate is actually associated with 0.58% of annual GDP growth. Next slide, please. The economic cost of inaction is unacceptably and unaffordably very high for Africa for not investing in our children education. For example, we know that Africa suffers from high number of out-of-school children. Our analysis for 10 African countries suggests that the economic cost due to out-of-school children is much higher than the required incremental spending. For instance, if we take Burkina Faso, the country has basically estimated to the country has basically lost around 15% of its GDP between 2009 and 2013. This means it is losing 6.3% of its annual GDP economic growth. On the other hand, the required amount of outlay that is needed to enroll these out-of-school children back to school is very negligible. We only require around less than 1% of our GDP. Next slide, please. When we come to social protection, investing in social protection services helps us to break the intergenerational cycle of poverty. To state the obvious, ensuring adequate access to social protection requires sufficient resources. But in Africa, social protection investments are invisible and underfunded. This gets even more paradoxical, given that more than 40% of the region's population are child-age population. Our finding entails that investing in social protection for children brings high economic returns. We have practical examples from Ghana, South Africa, Ethiopia, Rwanda, Zimbabwe, and what have you, and also from elsewhere, from Brazil, Chile, Argentina. The economic cost of inaction is pretty much very high, very high. Children from poor families have a higher probability of facing poor health, facing malnutrition, not attending school, engaging in child labor, and engaging in other hazardous work activities. These all have a say in their future productivity, which ultimately in large number is going to hit the economy very hard. Next slide, please. However, responses to child deprivations are both available and affordable. This is true in Africa, this is true elsewhere. Some of the priority areas for which governments and policymakers can act upon include, obviously, increased investment in our children essential services, but most importantly, there are two major anchors. One is to place children at the center of socio-economic policy-making agenda, because our policies are devoid of children in their motto. Again, the other critical issue is to recognize the urgency of children's needs and ensure greater political commitment and what have you. And most importantly, again, since the investment need in this regard is pretty much high, promoting public-private partnership will play a major role. Therefore, what the report saying is that at the end of the day, if we are committed, as we say that we are, to spur a long-needed inclusive development in our motherland, Africa, we need to invest in our common future. We need to invest now. We need to invest in our children. Otherwise, our development efforts will be devoid of the basic philosophical ethos and creeds for long-term human development, which is the bedrock for large-scale socio-economic development. Next slide, please. With that, I conclude my presentation and I invite our dear participants to read the full report that can be found in our website. And I also encourage all of you to use it in our debate and advocacy engagements on the subject. I thank you sincerely. Over to you, Chair.
Thank you, Dr. Addis, for this excellent presentation. Perhaps before we move to the next session, Dr. Nanyuki, would you say a few words on this occasion as we launch the report? Joanne?
Yes, thank you, Sarah, for the opportunity to speak again. But for the avoidance of repetition, I think I will emphasize the timeliness and the urgency of this report, and really that this report must trigger a conversation, but go beyond that. It must change our approach to economic planning and financial resource allocation at one level, but on the second level, it must also change how it is that we advocate for children's rights, recognizing that children's rights are first indivisible and children's childhoods are very short and transient, and how the interrelationship of financing really links strongly with health, nutrition, and social protection. And this reiterates that really ACPF is now entering a new frontier, the economic sector. And we are going to be looking at children's economic rights over and above the social and civil rights that we've been looking at. And so we have identified, as I said earlier, children and economic policies in Africa as a major component of our work in the coming years. And in our new 5-year strategy document, which we will launch at the beginning of next year and run through to 2026, we are going to be focusing on children and economic policy as an important facet in our advocacy work. And therefore, today's launch really is about initiating a conversation with the like-minded but different stakeholders and carrying it further in the next 5 years. I'm encouraged by the numbers of people that have logged on and are participating in this event, because it simply says there's a lot of interest in the subject, but more important that there is also recognition of the need to invest more in children, going beyond, as Dr. Addis just said, the moral argument of doing this. And so, ladies and gentlemen, our work has just started, and you can be sure that we as ACPF will be reaching out to you for deeper engagement and partnership in the coming months. And just to remind you that the report is now live on our website on a special web page we have created. Thank you, and back to you, Sarah.
Thank you, Joanne. We now move to a very high-level technical panel, and I would like to introduce to you 4 distinguished panelists. And what I'm going to do is actually present all 4 at once so that I don't have to come in between presentation at the later stage. So the first panelist is Ms. Amanda Di Vercelli. She is the Global Lead for Early Childhood Development from the World Bank Group, and she will be presenting the World Bank's experience with regards to the role of development partners in investing in children in Africa. The second panelist is Ms. Yolande Wright. She is from Save the Children International. She's the Global Director for Child Poverty, Climate and Urban, and she will be presenting the global perspective towards child poverty and economic policy. Our third speaker, Mr. Adrian Gauci, is the Economic Affairs Officer, Social Policy Section, Gender Policy and Social Policy Division at the United Nations Economic Commission for Africa, and he will be talking to us about investing in children and why it matters for Africa. The last speaker, Dr. Michael Sampson, is the Director of Research at the Economic Policy Research Institute, Cape Town, South Africa, and he will be presenting an overview on socioeconomic policies and children in Africa. There you go. These are the 4 panelists, and we will start with Ms. Amanda Di Vercelli. Amanda, you have the floor now.
Thank you very much. It's a real pleasure to be with you all today. Thank you for this invitation, and congratulations on the launch of this important report to ACPF. At the World Bank, we believe strongly that investing in early childhood development is the foundation for building human capital. We launched something called the Human Capital Project in 2018. It's a global effort to accelerate more and better investments in people for greater equity and economic growth. As part of this effort, we launched the Human Capital Index. And the Human Capital Index is a measure of how well countries are investing in their population. And what the index does is it measures the human capital that a child born today can expect to attain by their 18th birthday. And it highlights how current health and education outcomes shape the productivity of the next generation. And we decided to launch this work because we know human capital, the knowledge, the skills, and the health that people accumulate over their lives, is a central driver of sustainable growth and poverty reduction in countries. And more human capital in countries is associated with higher earnings for people, higher income for countries, and stronger cohesion in societies. But building human capital begins in the early years. It begins with investments in early childhood development. Dr. Addis Yimmer presented some of the findings from Africa, so I'm not going to repeat those, but just to share on the Human Capital Index, a child born in a sub-Saharan African country today, on average, can expect to achieve only 40% of his or her future productivity, compared to if he or she were to enjoy complete education and full health. So this score for sub-Saharan African countries as a whole of 40% on the Human Capital Index compares to 56% for children globally. So it's a very big difference. So it's a lot of missed human capital. And this low score is explained by high mortality and high stunting rates in the region, as well as low levels of student learning outcomes. And all of these things have a direct effect on economic productivity. But there have been many notable recent gains on all of these indicators in recent years. So the trend is moving in the right direction. It's just not moving fast enough. So through the Human Capital Project, we're working with more than 80 countries to accelerate progress toward a world where all children can achieve their full potential. We know that a child's early years are a critical period to invest to promote learning, health, and future productivity. In the first 5 years of life, 90% of all brain development occurs. And we know that we must make the right investments during these periods. We are delighted to work with countries across the continent to invest, to support investments in young children's development. And we think that despite the many challenges, one of the real opportunities in investments in early childhood development, in particular right now, is that with access to services in, for example, early childhood education being relatively low, many countries have an opportunity now to invest strategically to build better systems and to scale quality investments from the start rather than having to fix broken systems later on. We also know that the COVID-19 pandemic has disproportionately affected young children and their families. The statistics are staggering. We know that children have experienced substantial deprivations in the last 2 years in food insecurity, in limited access to early learning, stress in the home, increased rates of domestic violence. As we consider efforts to build back better following this pandemic, as we emerge out of it, we must ensure that investments in young children are front and center, and that we continue to advocate for investments in young children's development in the context of the COVID recovery. I'd like to end just by highlighting a few examples of some of our work in partnership with countries in the region that we're very proud of to be a part of. The first project is called the Senegal Investing in Early Years for Human Development Project. It's a $75 million project. It's multi-sectoral, and it will reach 2.5 million children and their parents through integrated community-based nutrition, early stimulation, and parenting programs. It'll enroll more than 210,000 children into formal preschools, Quranic preschools, and community-based early learning programs, construct 220 preschool classrooms, and increase access to birth registration in the country from what was about 46% when the project started to more than 70% today. The Senegal project is a nice example because it's deeply cross-sectoral. Working with multiple ministries across the government of Senegal to think about integrated and innovative solutions to work with communities, local government, national government, and different sectors to support young children's development. Another project I wanted to highlight is in Liberia. It's called the Economic Empowerment of Adolescent Girls and Young Women. It's an innovative approach that takes a training and jobs program for adolescent women and integrates early childhood development and childcare as a training track into that program. So it trains young women to be early childhood educators or childcare workers, or to open their own small business and childcare, giving them both business training and training in child development. We've seen incredible returns on that project, more than 90% completion, more than 90% enrollment, more than 90% employment, increased savings rates for the women, increased sense of empowerment, reduced intimate partner violence, and most importantly now for the next generation, increased knowledge of child development. And now we're starting to see changes in the quality of the child development services that they're providing. In Cameroon, Niger, and Ethiopia, and many other countries, we're working with governments to increase access to storybooks in local languages, in the languages children and their parents speak at home, and to give parents support to engage with their children's learning. We know parents are critical in these efforts to engage in young children's learning in the context in COVID and moving forward. And finally, in many countries, including Madagascar, Kenya, and Rwanda, we're working with partners and governments to scale up cash transfers and family support programs to target families in need with financial resources and information to invest more in their children's development. And in the context of the COVID recovery, these cash transfer programs are increasing dramatically. So these are just a few examples I wanted to highlight. I want to really thank you again for the invitation to be with you today. Congratulations on the report launch, and I look forward to the rest of the session today. Thank you very much.
Thank you. So I think I should go ahead next. My name's Yolanda. I work for Save the Children, and I want to say thank you so much again to ACPF for inviting me to speak today. This is a topic incredibly close to my heart personally and to Save the Children as an organisation, and we're delighted to support you in launching this incredibly important report and sort of reinforcing some of those messages that Dr. Yima and Dr. Nyakungu also highlighted at the beginning. Highlighted at the beginning. I'm going to focus this particularly on the issue of child poverty and some of the global lessons that we've learned at Save the Children through our work, particularly because it highlights these issues very, very well. We believe that child poverty remains, as was said at the earlier, one of the sort of greatest challenges that we are facing as a global community. We know that it's not only just a moral outrage. I mean, it is a moral outrage. Children's rights are being failed to be upheld throughout the world in multiple ways. But it's also an economic failure because of all the failures to reach up children's full potential and the lifelong impacts that growing up in poverty can have. So I hope to sort of highlight some of those lessons and then pick up a couple of key recommendations, particularly around universal social protection that Save the Children think are really important and help to unlock access to all those other really important services that we talked about: education, early childhood development support, health, etc. So I'll start by just highlighting the situation at the moment. We're in a really difficult time, and that's why this report is so timely. We're in the middle of the COVID crisis and the economic effects of that crisis. And as Amanda said, we also have found some shocking impacts of COVID on children. We've done global surveys with thousands of children responding from around the world and have been really shocked by the impacts on children, the impacts of school closures and on having to learn from home, the loss of their safety nets and their the protection that's provided through attending schools and other formal learning environments, the stress in the family homes, the increase in domestic violence that they've experienced because of the stress at home, also the increases in child marriage, child labour, many other things that have been highlighted. We did a study with UNICEF, and we estimated that over 142 million more children may end up living in poverty as a result of the economic shocks of the COVID crisis. So now more than ever, we are facing a potential decade where some of the gains that we've fought so hard to achieve might be lost, and we need to be thinking about how do we move forward and build forward better for the future. And I'm going to pull, I don't mean to be just doom and gloom, but I'll also mention the climate crisis because I've just returned from COP26 and the climate conference. And we know that the climate crisis is going to bring further shocks to our societies. And the lessons of COVID about how economic shocks really disproportionately impact on people who are already living in poverty, how they exacerbate inequalities. We know that will be the same with the climate crisis. So we need to be putting in place systems and services that are resilient, that are forward-looking, that consider how to help and support families to cope with these potentially increasingly frequent shocks, whether they be COVID, whether they be conflict, and whether they be climate-related. And we believe that we can do it. I don't think it's an inevitable cycle. I definitely know that some countries around the world have been proactive in looking at making these investments in children. I mean, you only have to look back to the Second World War in Europe, when a number of European countries put in place really forward-thinking investments in children, investments in children and adults, actually, such as universal healthcare provision, commitments to universal primary education, and importantly, universal child benefits in a number of countries. That wasn't a time when European countries were economically particularly secure. They didn't have a huge amount of budget available for such investments, but they made those choices, those forward-thinking choices about investing in the long-term benefit of their citizens, recognizing that human capital really is just as important, if not more important, investment than physical infrastructure and other types of investment. So I'm painting a little bit of a scary picture about COVID and climate, but I'm also saying that actually we can take this at a moment, never waste a good crisis. This can be a real moment when we reevaluate our priorities and put in place some really strong investments that we know will benefit children now and in the future. because as we know, the child who's well nourished, especially in those key early years, the child who receives a good education, who's protected, goes up to be a better earner, have more economic prospects, and potentially then also have children slightly later in life, be able to provide economically for those children in a better way. And so building this positive reinforcement. And also all those skills and capacities will help us to build the future that we need to see in terms of a new economy, new types of economies that will be more climate resilient, more sustainable. We need children to grow up with all those capabilities to work in what we hope will be quite a different world in future. So I'll just pick on social protection in particular for a minute. We know that social protection coverage is not meeting our commitments that we made in the SDGs to children, nor in the universal commitments we made to children in the Convention on the Rights of the Child. And there's a particularly big gap in Africa, unfortunately. I mean, globally, we're not meeting it. Only about a quarter of children globally have social protection, but in Africa, it's an even lower proportion. And yet we know that those returns on investment for social protection could be really enormous. And even for relatively small monthly payments, they can really help families not just cope with immediate needs, paying for food, etc., but can actually help to build resilient livelihoods. The amazing thing about cash transfers is they don't just support one or two aspects of a child's well-being. They can actually support school enrollment and attendance. They can support better nutrition. They can help buffer some of the shocks that families experience. So we've seen that those kind of investments can really unlock a number of the other things that we think are so crucial to children. So I think I'll draw a conclusion now, but I mean, basically, for Save the Children and for a number of our other colleagues on this call, the overwhelming case for the economic case for investing in children is really clear. We need to be looking at the countries that have made these investments and some of the benefits. I mean, we can name in the African continent countries like South Africa that have been growing their child grant systems and really seeing some positives and busting some of the myths that are out there. So, for example, there was a real concern that child grants might encourage people to have children. Well, in South Africa, we've seen actually that it's delayed the age of the parents at the having a child, and also spaced children, the number of children they've had. So completely dispelling the myth that we'd be incentivizing people to get married or have children early. We know that there's also really strong potential benefits in creating social cohesion. Universal approaches prevent the them and us, the sort of stigmatization of certain families, and help to be really transparent systems that can create incentives for registering children, incentives for tax paying, because you know as a family that in a difficult time you'll be rewarded by some support from the government. So I hope that gives you some sort of positive outlooks about how we can see those investments. And I think the final thing to mention is universal systems also have a fantastic capacity to be shock responsive. So in response to COVID, we've seen countries with strong systems able to quickly make payments out to families in need. Even in the US, we saw that the payment packages that went out really helped to buffer the impacts of the COVID crisis on child poverty in the US. So we do think that these kind of systems will be really helpful in the future for things like the climate crisis, and can be used to trigger quick and effective payments, hopefully in advance of a crisis, because we know that anticipatory action is much more dignified and economically efficient as well in responding. So I hope those are some useful thoughts. Thank you so much for the opportunity. I'll pass to the next speaker.
The name is Adrian Gauci. Good afternoon, everybody. Thank you for the opportunity given to me by ACPC to present some of the work that ECA is doing. We started off from, as usual, people have started off from COVID. And COVID created a number of aspects, but in particular, it exposed previous existing vulnerabilities. So we were starting from there. And the pre-existing vulnerabilities in health were of a particular type. And we thought that this would be useful to hone in on, to focus on. So this was done together with the London School of Economics. So the idea was to go beyond the big three. So it's usual that HIV, TB, and malaria are the big three. But if you look at other infectious diseases, they cause quite a lot of mortality and quite a lot of morbidity. Now, the idea was, next slide, please. Thank you. So what we did is we looked at the literature over 20 years and we honed in on two specific diseases, diarrheal diseases and lower respiratory tract infections. And we focused on 6 countries. And we looked at how this was done. Because our idea, please bear with us, our interaction is with ministers of finance. So we are trying to persuade them of the rates of return, as my previous colleague was saying, and to show that what you are investing now, rather than a social expenditure, is a social investment. So we developed 2 models. One is the cost of action model, and the other is the cost of inaction model. And we use Nigeria. And next slide, please, so that I don't take too much of your time. So, in Africa in general, LRTIs and DDs, roughly, are 27% of under 5 mortality. So it's very high. And therefore, we said, let us hone in on this. Why Nigeria? Because of the size of the population and because of the way we are looking at the problem. Next, please. Next, yes. Go on. Let me go to the models, which I think would interest people well. So, from the rapid reviews of 20 years of literature, what we found is that the most cost-effective, this is very interesting, for both LRTIs and DDs are the rotavirus vaccine and the pneumococcal vaccine. So, even in infectious diseases where the vaccine has been shown to have the highest effect, given the fact that it's not causing the same type of hype that COVID has, it's not being used in health systems within African countries. This is a very interesting idea. Secondly, cost analysis from a societal point of view were quite rare. LRTIs, similar. The doses range from $32 to $30 per vaccine. Next, please. So, our cost of action model was based on 3 scenarios. So, business as usual. So, basically, over a period which leads up to 2030, what we did is we said, business as usual is it will be scaled up by 5% between now and 2030, so over a 9-year period. The moderate scenario is a 50%, and the aggressive scenario is a 90%, trying to reach universal health coverage. What we used for the cost of action was the WHO designed health tool, which when I show you the results, has proven to be extremely useful. The innovation, next slide please, the innovation that we tried to introduce was the cost of inaction. So, what does it cost for people to care for children who are sick with these 2 diseases? We're always talking about 2 diseases and always talking about Nigeria. And what is the productivity lost over children who die over the period that they would have lived, taking life expectancy as our metric. Next, please. Yes. So, some results. These are quite interesting results. So, with national targets, so basically it is within the health strategy of the country itself, the health costs from 2022 now to 2030 would be 1.3 billion. The spending would increase by 0.99%, so small. The health costs in terms of GDP would increase by 0.032%. The benefits are 3.3%. Look at how this changes. And the cost benefits caring for the sick is 3, and the cost benefits, including the mortality that you would avoid, is about 10 times as much as you would invest. So these are so this is for diarrheal diseases. For LRTIs, we've got similar results. They're a bit lower because LRTI treatments are a bit more expensive in general. So again, our health costs would increase by 1.8%. The health gains would be 4.3% at a cost of at an economic gain of 0.45% of GDP. So if you estimate it over a 9-year period, that's a hard figure of GDP. It is 8 times the cost-benefit ratios. These are the child deaths the last column, that would be averted if these are implemented. So 500,000 and 600,000 for LRTIs. Next, please. Next. So, what are we saying? The investment cases for addressing both DD and LRTIs are extremely strong. The cost of inaction is much higher than the cost of action. This is a very important aspect that the Minister of Finance stood up in his seat and said, what does this mean? It means not doing anything will cost you more than doing something. So this is something that we will be pushing quite heavily. The economic gains, I'm repeating myself, over the next 6 decades as a result of preventing deaths of children under 5, over the period 2033, 2094, and people might ask 2094, that is the child who is living life expectancy in Nigeria, he would live to 2094. And therefore, the cost-benefit analysis, as we showed before, would be 10 times for diarrheal diseases and 8 times for LRTIs. So here, next, and I think we've ended here, and I must apologize, colleagues, that I'm in a statutory committee, so I'm moving in and out. I would have loved to stay for all the presentations, but I'm sure I will contact Yima and get all the presentations. They were interesting in what I heard today. So the idea is we've got an economic case to put forward for investing in children, in particular, because this was our focus, on DDs and LRTIs, which represent, I repeat, 27% of under 5 mortality, and the rates of return of not doing so are 10 times for DDs and 8 times for LRTIs. And I would like to thank you, and I'd like to apologize again, because I have to leave to another meeting. Excuse me, I hope you enjoyed our presentation. Thank you very much.
I will continue. First, let me thank all of you for the opportunity to discuss socioeconomic policies for children in Africa. The next slide, slide number 1, gives you an overview of what I'll be talking about. Essentially the what, the why, and the how of socioeconomic policies. So slide number 2, the next slide, gives a definition of what we're talking about here. They're integrated government initiatives that bring together vital social policies that we just heard about from Adis and the other presenters that are so vitally important for children, but integrated with economic interventions in order to support livelihoods and food security, nutrition, and basic needs. These deliver children's rights. They support children's well-being and development. The next slide illustrates a very important point about socioeconomic policies. They are best constructed around the life cycle of people. And social protection that Yolanda just highlighted follows a similar model. People face vulnerabilities that are different. Pregnant women face vulnerabilities differently than older people. Adolescent children face different vulnerabilities than babies. And we need appropriate socioeconomic policies, including social protection policies that are relevant at each stage of life. And the next slide, slide 4, illustrates another very important point about socioeconomic policies. They represent a new math. All the different components, health and education and community development and social protection. If we go to the next slide, slide number 4, we'll see this illustrated. They have to fit together and work in an integrated way in order to achieve outcomes for children. There's a new math. 8 minus 1 equals, well, maybe not 0, but nothing close to 7. If any one of these gears is missing from the process, the results for children's development and their contribution to the future prosperity of the nation will be compromised. But working together, as we see in the slide, next slide, please, slide number 5, socioeconomic policies for children can contribute to at least 14 of the 17 Sustainable Development Goals. Now, I don't have time to go into all of these, but I want to focus on a couple of these key factors because I want to talk about that second question in my overview. Why, and if we go to slide number 6, the next slide, why are socioeconomic policies important? I'll focus on 2 main reasons. The first one, just referenced by the ACPF executive director a few minutes ago, the opportunity posed by the demographic dividend. This slide illustrates what demographers call the dependency ratio. How many children and older people depend on each worker in countries and regions around the world, mapped over the past several decades. And all of these, to varying degrees, have reaped demographic dividends as youth have transitioned into the labor force. Now, the next slide illustrates this a little bit more clearly. See that green curve to the left? Japan's falling dependency ratio in the 1950s and 1960s coincided with the fastest rate of economic growth in recorded economic history up to that point in time. A couple decades later, falling dependency ratios in China and the East Asian tigers coincided with the greatest wealth creation process the world has ever seen. Africa's dependency ratio, that orange line to the right with a much gentler slope, that's been falling much more slowly. But what's interesting is what happens when the demographic window closes, when dependency ratios start to rise again. In Japan, the economy stagnated in the 70s and 80s. In the upper middle income countries in Asia, they faced a middle income trap of slowed growth. Fortunately for Africa, this is decades away, but the window will close. And it raises this vitally important question. How can a country increase its living standards if there are fewer and fewer workers for every dependent? The only solution we know is to enable labor productivity to grow faster than dependency ratios rise. And this is why Adi's report on behalf of ACPF is so important. Investments in children produce economic payoffs for decades and intergenerationally. Which brings me to the next slide and my second point, the topic of recent medical research. We just heard from Amanda from the World Bank how important early childhood investments are. Research into how the brain works shows that socioeconomic policies that invest in children, particularly in early childhood, generate the most powerful economic returns that governments and their development partners can achieve. This contributes to a special human capital, cognitive capital. Yolanda just referred to the importance of social protection investments in nutrition, in cash transfers that support a whole range of powerful outcomes. The next slide illustrates how this affects the brain, supporting nutrition, enabling families to provide better care, supporting through complex pathways, safety and protection. The next slide, slide 10, shows the key output from these investments in good socioeconomic policies. They help build cognitive capital. I'm not just talking about intelligence. I'm talking about that complex set of functions that sit in the brain: socio-emotional skills, creativity, flexibility, the ability to work collaboratively. Why is this important? 50 or 60 years ago, countries could grow rich by channeling labor from agriculture into manufacturing. But today, that just creates a hyper-competitive race to the bottom, with adverse climate change consequences to boot. More importantly, it's not the best way for Africa to become prosperous. Today, a college dropout taps at a keyboard and creates an app and a startup that grows to a market capitalization of hundreds of billions of dollars. Today, the source of the wealth of nations is cognitive capital. And it cannot be mined, it cannot be manufactured, it can't be traded, it can't be arbitraged. It can only be carefully cultivated by families supported by effective socioeconomic policies for children. The next slide illustrates important findings from Nobel laureate James Heckman. Investments, particularly prenatally, antinatally, and in early childhood, but also throughout a child's childhood, generate the highest economic rates of return of any investments we know. The next slide, 12, shows the results of impact assessments around the world on investments in children, improving height for age as a proxy for all the developmental outcomes that are associated with cognitive capital. I'm just going to note that that missing value for Honduras is proof of a really important point, that the how, which I'm going to turn to next, can be very complicated. This next slide here illustrates how focusing on just single sector solutions are not likely to be affordable or effective. It maps out spending on nutrition programs as a single sector way to reduce stunting. And you can see no matter what you spend, you're never going to get to zero. The next slide shows what happens if you integrate policies together: health, education, water, sanitation, social protection, livelihoods. You drop that cost curve down and you steepen it so you can get to zero. The slide 15 reports empirical evidence from a study we did with UNICEF in Ethiopia. Those red dots represent districts, WOREDAs, in Ethiopia that have carefully integrated health, education, agriculture, social protection. The blue dots are other WOREDAs that did not. You can see that the impact of health expenditure on improving nutrition in low synergy districts is almost zero, whereas high synergy districts can improve this nutritional outcome. And this is just illustrative. We did this for 10 of the Sustainable Development Goals. Comprehensive and integrated programs can work. I want to conclude with a few points on slide number 16. First, and most importantly, comprehensive and integrated socioeconomic policies for children deliver rights, and they improve child well-being, and they contribute to a range of developmental outcomes for children. And let me emphasize what Yolanda highlighted: universal systems work best. Second, these investments in children are necessary to assure inclusive social development and equitable economic growth. They are the best investments in Africa's future prosperity. And there are many lessons. I could talk for another 10 minutes, but I don't think I would be allowed to, about effective design and implementation. But one lesson stands out. Socioeconomic policies must be comprehensive and integrated. Any gap or deficit in health, education, social protection, water and sanitation, child protection, gender can fatally compromise the system. And as Adrian just so robustly reported 10 minutes ago, impose enormous costs of inaction. Thank you so much.
Thank you very much to our panelists for your informative presentations. Unfortunately, today we do not have a question and answer session, but we promise to our audience that all presentations and the video of this session will be uploaded on our website in a couple of days' time, and we will alert you all once these materials are available online. This is a lot of resources, content that was just shared in just the past 1 hour. I'm sure that will be of use to many of us. And again, thank you very much to all 4 panelists for your interventions today. Great. I see we are keeping time. We're now going to go to the second part of our program, and it's time for the Guy Larissa Award 2021. For those who have not yet heard about the Guy Larissa Award, this is an ACPF initiative that started back in 2005. It's an award that highlights and rewards exemplary initiatives aiming to improve the well-being and rights of children in Africa. Each prize is dedicated to a special theme. So far, from 2005 to 2014, we had 5 different awards given to different organizations in 2005, 2007, 2012, 2010, 12, and 14. The 2021 Guy Larissa Prize is dedicated to the elimination of child labor in line with the declaration by the UN General Assembly for 2021 as the year for the elimination of child labor. I don't want to say more on this, as we have a number of speakers on this, but also some video presentations. So we will start first with an infographic documentary entitled Child Labor, a Persistent Scourge. Let's watch it together.
Globally, about 160 million children aged between 5 and 17 are engaged in child labor. Over 50% of those are in Africa. The worst affected are between the ages of 5 and 11, mostly rural, mostly in agriculture. In Morocco, it is estimated that 50,000 children are working as domestic workers in homes. In Mali, between 10,000 and 15,000 children are working on plantations. In Côte d'Ivoire, many of them are victims of child trafficking. In Tanzania, about 4,600 children are working in mining. Children as young as 8 dig 30 meters underground for 8 hours a day. If we do nothing, 8.9 million more children are likely to be engaged in child labor by the end of 2022. Every day, a child suffers. Every day, we can act. The time to act is now. African Child Policy Forum was established with the conviction that putting children first on the public agenda is fundamental for the realization of their rights and well-being. ACPF has provided invaluable insight into the factors that lead to child labor and the effects on children. Poverty is the single most important factor behind child labor. About 26% of children live in low-income countries Countries affected by fragile political states or conflict often engage children as child soldiers by local militias. About 38.6 million children are involved in hazardous work every day, exposing them to risk of death or permanent disability. These children are also more likely to suffer from malnutrition, leading to serious health and mental health conditions later in life. It also affects their overall social development, denying them time with other children or even their own family. COVID-19 has pushed many children into extreme poverty and accentuated their involvement in child labor. In 2020, the pandemic increased the number of children in income-poor households by an estimated 142 million, adding to the 582 million children already in poverty in 2019. ACPF has been instrumental in progress that has been made to combat the growth of child labor. The domestic laws of all African countries except Kenya, Sierra Leone, and Uganda are now in line with the ILO Convention. And 29 have gone further, setting a minimum age of employment higher than 14 years. Congo Republic, DRC, and Gabon have set it at 16 years. Uganda, Tanzania, and Togo now have 25 child ambassadors and provide education to employers on the negative impacts of employing children. Chocolate companies like Mars, Hershey, and Nestle have signed a deal to end the use of child labor in their chocolate production. Barack Obama's Trade Facilitation and Trade Enforcement Act prevents the importation of goods into America that child labor has produced, while the African Union Action Plan aims to eliminate child labor in Africa altogether. The Ivory Coast signed the Harkin Engel Protocol to monitor child trafficking and eliminate child labor in the cocoa industry. Mali, Rwanda, and the Ivory Coast have strengthened occupational health and safety regulations for children, while other governments have appointed committees or working groups to examine the problem. Gambia and Benin have created a new government task force to combat human trafficking, especially in children. Mali has raised the minimum age for work to 15 and expanded the list of hazardous occupations prohibited for children. We understand that ending child labor requires a multifaceted response that addresses economic, social, cultural, and legal forces. We need to repeal outdated laws, strengthen enforcement and child protection systems, and follow international standards. We need to ensure access to social protection programs to mitigate poverty and invest in free, good quality schooling, or provide viable alternatives. We need universal access to birth registration so that children have a legal identity and better protection. We also need a national evidence database on child labor and introduce routine data collection and surveillance. We need to work towards a change in mentality with community-based dialogues, social and behavior change interventions, and parenting programs. And, more desperately, we need to strictly regulate multinational corporations and global supply chains to prevent exploitative labor practices. We need to do all this immediately and effectively to eradicate forced labor, end modern slavery and human trafficking, and most of all, eliminate one of the worst forms of child labor, the recruitment of child soldiers. But our pledge does not end there. Let us work together to end child labor in all its forms, forever, from Africa.
Good. I would like now to introduce the next speaker, who is the 2014 Nobel Peace Laureate, Mr. Kailash Satyarthi. Mr. Kailash Satyarthi was a founding member of the International Board of Trustees of ACPF. He campaigned against child labor in India and advocated for the universal right to education for many, many years. He was unfortunately not able to join us this afternoon as he is traveling, but he has sent us a video message. And in this video message, Nobel Peace Laureate Kailash Satyarthi will be announcing the winner of the Guy Larissa Award 2021.
My dear children, sisters and brothers, I really feel very, very thrilled being with you. It's like homecoming and being with the family. I recall my beautiful days traveling to Ethiopia with my friend Asefa Bekele and the days of foundation. I've also learned how to eat that I always liked, Ethiopian food, injera, and you have a lot of vegetarian stuff. And this is because I'm a vegetarian, so it is like being at home. But today, we are talking about a very serious subject. New challenges which are emerging due to pandemic, but also some of the shocking data of increase in child labor globally. Just take off African continent. 4 years after announcement of Sustainable Development Goals, the number of child laborers in Africa has increased from 65 million to 86 million. And there is no justification, there is no excuse for it. This is before pandemic. And we are afraid to see that this situation would be worsened due to pandemic. This means there are some very fundamental reasons. And one of them is systemic and institutional discrimination of this region in the geopolitics, in geoeconomy, but also within the countries. How come this can happen? Increase in child labor is a manifestation or a proof that this deep-rooted discrimination continues. And that has brought exclusion, that has brought deprivation, that has brought lack of opportunities in decision making or the positions of leadership globally. And when we talk of increase in child labor, means we talk of denial of education, denial of healthcare, denial of future opportunities, but also increase in adult unemployment. That means increase in poverty. So that makes the full vicious circle. Discrimination and exploitation of children are the two sides of same coin, particularly when it comes to racial discrimination. I will give you another example. Child labor is outlawed. It's a crime in Europe and America. The big companies cannot employ child labor, but they can easily employ, and they are employing children as child laborers in Africa, in Asia, in Latin America. How could it be possible that something is crime in your own country with your own children, but that is not happening in other parts of the world which you keep on exploiting? Dear friends, the fight against child labor is also the fight against this racial discrimination at all levels. I would add another thing. Pandemic has exacerbated and exposed many of the evils and injustices in the society. And one manifestation of racial discrimination is vaccine apartheid. And this is not just coincidence. There's another alarming example. Rich countries have allocated $12 trillion for COVID recovery. Single industries in those countries have received more funds than the combined allocation in entire low-income Africa, low-income countries of African region. This is unacceptable. We have to stand up and raise voices against this. This is just one example. Another fact, which is equally shameful, that globally 22 men own more wealth than the combined wealth of African women. There are so many examples of inequality and injustices, economic injustice, which is again one or another manifestation of discrimination and a kind of economic apartheid. So, dear friends, we have to raise the voice against those things. We need bold, strong leadership, moral leadership, loudest possible voices from Africa itself. You have to reverse the course of history. You have to bend the arc of history in favor of the poorest people and poorest women and the last girl living in sub-Saharan Africa. Young people can do it. When I express my fullest faith in young people, I would also like to underline certain things. One is that you have to be courageous enough to speak against internal issues as well. And one of them, which is really very serious, is fragility and armed conflicts in certain states. Of course, there is a vicious circle of unemployment and lack of opportunities and perpetual discrimination and injustices which lead to the violence. But violence cannot be an excuse. Young people have to stand up and raise their voices for sustainability and peace while fighting for the values of justice and equality. We have been demanding a simple, however it is a bold initiative, for universal social protection. And we have given a call on behalf of African young people through 100 Million campaign and through Laureates and Leaders group that a global social protection fund should be created. And that is not a big deal. Only $53 billion annually can ensure social protection for every child and every pregnant woman in all low-income countries. World is not so poor, dear friends. There is a poverty of compassion. There is a poverty of courage. The poverty of prioritizing the issue of children. Who else will do if you don't do? I always say that Africa is the mirror of the world. Nobody can blame African people and African young people. Something is going on wrong somewhere. And marginalized people in Africa are victimized for that. They are paying the cost of it. You are not poor people because you have enormous wealth of power, wealth of minerals, wealth of water, jungles, wood, everything. The only thing is that you have to prioritize the issues of the marginalized people in the country and in the rest of Africa, and then lead the change in the rest of the world. I am confident that you guys will be able to do it. Dear friends, today I have another pleasure, and that is to announce the award which many of you must be waiting for. I can read it out. It gives me great pleasure and honor to announce the winner of the Guy Larissa Award 2021, a special edition dedicated to recognize and award an organization that has made outstanding contribution to the elimination of child labor in Africa. Wow. And the winner is the Good Shepherd International Foundations in Democratic Republic of Congo, DRC. Congratulations, dear friends. The integrated program was initiated in Kolwezi area in Lualaba province. May I not be pronouncing properly. This is my fault. I have to stay longer in Africa, and next time I promise you that I will learn more names of places and people when I stay with you. So anyway, so this is in DRC. Has rescued thousands of children from the worst forms of child labor in mines with the harshest environment and unsafe working conditions. These children were as young as 5 years in some cases. The Good Shepherd International Foundation works in low-income countries to address the root causes of poverty and promote inclusive and sustainable development for the most marginalized and vulnerable people, such as children and women. I wish to extend my heartiest congratulations once again to all the sisters for the extraordinary work you are doing in combating child labor. It is my hope that many other organizations and individuals will be inspired and learn from your experience. Thank you so much.
Thank you very much, Laureate Kailash Satyarthi, for your message. Congratulations to the winner of the 2021 Guy Larissa Award. We have the sisters from the Good Shepherd sisters from the Bon Pasteur Kolwezi project in DRC are online right now, but to avoid internet problems, they have sent us a video message, with their acceptance speech. So let us hear to their acceptance speech now.
It is not possible to close our eyes to the exploitation of children deprived of their rights to play, to study, and to dream, Pope Francis says. No one of us has chosen where to be born and who begets them. The same way, children don't choose, but nature chooses for them. As long as we are born and God wakes us every day, life commands us to live. Whatever circumstances life offers us, we are charged with the responsibility. The sense of responsibility changes our attitude towards life and calls us to action. Since 2013, the Good Shepherd International Foundation and Bon Pasteur have been working in Kolwezi, the global capital of cobalt, to protect children's rights, helping over 3,000 children from the mines into schools, thanks to the multidimensional program that involves families, communities, and public and private stakeholders. The Democratic Republic of Congo is the origin of over half world's cobalt, a mineral that is essential for the production of lithium batteries in electric cars, phones, and computers. These technological gadgets serve as the foundation of modern global commerce and communication and the future of private transportation. Behind the global devices purchased around the world, from Apple, Microsoft, Samsung, Tesla, and numerous others, it is a labor force that the UNICEF estimates to include over 40,000 children, many of whom are out of school. At a typical cobalt mine in the DRC, children can be found working without gloves and masks as they sort cobalt from the mines by hand. This task exposes their skin and lungs to cobalt dust, which the World Health Organization has reported causing long-term health problems. Birth defects are also common in babies born to mining mothers. Children whose families' poverty and lack of decent work opportunities are likely to force them into full-time mining work by the time they are teenagers, if not as soon as they can walk. Poverty is the key underlying factor. A secondary reason is lack of diversification of livelihoods. The family's main concern is food for the day. They know that artisanal mining is risky for their children and themselves, but the basic concern is survival, food for the day more than safety. By extending our model of community-based protection, the children will be safe from human rights violations such as the worst forms of child labor and gender-based violence. In these safe spaces, they will be able to access basic human rights such as education, healthcare, and skill training, fostering their physical, psychological, and social development. In 2018, we embarked on a 5-year strategic plan. By 2022, we are expecting 6,080 children from artisanal small-scale mining communities of Kolwezi to be protected and supported to quit the mines and develop their full potential in schools and in secure community settings. We are reaching out to 8 mining communities where we have established 6 informal schools for children that provide education and feeding programs. Along with education for children, we offer development sustainable initiative activities such as alternative livelihoods, community cohesion, advocacy, economic empowerment for girls and women, and positive parenting formation. This is why we all are gathered here to tell the world that the future unfolds through the children. Guy Larissa Award is dedicated to the tragedy of 1 in 10 children who die before their 6th birthday. Here we are in honor of that 5-year-old, bright, clever, and happy child by advocating elimination of child labor. We thank everyone who has joined in advocating for elimination of child labor by 2025. Thank you, African Child Policy Forum, for all the efforts to bring hope to children's dreams and all who love children and care for their future.
The African Child Policy Forum was proud to invite nominations for the 2021 Guy Larissa Award in June 2021. This year, the special edition of the award is looking for outstanding contributors to the elimination of child labor in Africa. The Guy Larissa is a biennial award aimed at recognizing and rewarding an organization or individual who has made an exceptional contribution to promoting child rights and well-being in Africa. The nominees may cover a broad range of activities, such as healthcare, education, nutrition, or care of orphans or other vulnerable children. This award is dedicated to the memory of Larissa, who passed away tragically at the age of 5. During her short life, she brought immense pleasure to her parents, grandparents, and friends. Larissa was highly sensitive, intelligent, kind, and generous. The award symbolizes the tragedy of 1 in 13 African children who die before their 5th birthday. It is an award to celebrate good practices and promote their replication by other actors, both from government and non-government sectors. The winner of the Guy Larissa Award 2021, the Good Shepherd International DRC, initiated an impressive program in Kolwezi DRC that helped 4,800 children quit the mines and attend schools. Its holistic model of intervention integrates education, alternative livelihood, and social protection to address the root causes of child labor and keep children in school.
Thank you very much to Sister Justicia Pili Nekeza for her acceptance message. We are now approaching to the end of our program. We managed to, keep time. We thank all our speakers for really keeping time today. And I would now finally invite Dr. Joanne Nyanuki for her closing remarks. Joanne, you have the floor.
Thank you, Sarah, and thank you to all of our participants who stayed with us to the end. But I think before I close, I want to really congratulate the Good Shepherd International Foundation in the DRC for being the recipient of this special edition of the Guy Larissa Award, and to really tell the sisters who are doing this good work that their efforts speak for themselves. And I hope this award is going to encourage you to continue with the selfless work you're already doing to improve the lives of children in difficult situations. And I think it is evident to all our listeners on the impacts and the effects of weak and failed economic policies that are driving children into abuse and child labor. Ladies and gentlemen, before I close, I will also do one more thing. I wish to share with you the results of the selection which was carried out by an independent jury for the Guy Larissa Award. And I want to name the second and third place. In second place, we had Investing in Children and Their Societies, ICS, Côte d'Ivoire. And we recognize ICS Côte d'Ivoire's efforts in averting the risk of child labor in cocoa supply chains. And the skillful parenting program that they ran has achieved outstanding results in preventing child labor and promoting children's positive developments. And it demonstrates the importance of what we had earlier of comprehensive multi-pronged strategies in eliminating any abuses of children, and specifically in this case, in eliminating child labor. We commend their efforts, and congratulations to Investing in Children and Their Societies, Côte d'Ivoire, for coming second. Third place was the Rwanda Extractive Industry Workers Union. And this workers union advocates against the worst forms of child labor happening in farms, factories, mines, and quarries in Rwanda. and their efforts are impressive but also unique because as a non-traditional child rights actor, a workers' union has gone on to include in their agenda and in their initiatives the protection of children against child labor. And we have identified this as a promising initiative as it demonstrates the importance of all actors from different sectors, including trade unions and workers' unions, coming together to promote children's rights and well-being. So now to come to my closing, I want to thank all of you, our dear listeners and our speakers for sharing your work and your deep knowledge on the subject. And for me, my take home is simple, is that not doing anything costs more than doing something. So it's important that you take home the message. And thank you for our speakers for all your efforts and your time with us. Thank you to the different organizations, individuals, funding partners, and technical advisors who have also made significant financial and technical support in this research and to make this initiative a success. I wish to also acknowledge and recognize the members of our independent jury for generously volunteering their time and using their expertise in the selection of the award winner. And with that, ladies and gentlemen, dear participants and listeners, thank you for being with us. Thank you for your commitment to children. And I wish you all a good evening and a good afternoon.